Here's assistive devices. Our faculty said, hey, man, the textbook is brutal. It's very hard to teach this class. Could we film these techniques, right? Show them once how to fit it. So they go in and they say, you guys, we're going to learn how to do fitting this week. Please watch the fitting videos. When they come in, it is so easy for them to grab the different devices and start practicing fitting, right? And then it's like, hey, we're going to learn about some gait patterns. So in the Gait app, so I'm taking you back into the app here, you can see, oh, gait patterns, great. You're going to learn about a modified 3-point gait. Some of you have walkers, some of you have crutches, so let's watch the video for crutches. And we filmed everything for the right and left lower extremity. The reason why we did that is because eventually our students will use this as a tool in the clinic. So they will be able to show, hey, this is right leg, this is you using your crutches, this is what you're going to do.
Have the patient first bring the crutches forward, then the right leg, and finally step through with the left leg.
So they watch it together in class, or they watch it with a patient, and then they email this directly to the patient. So that feature actually becomes now a clinical utility tool. So I'm going to send this to James, and the patients don't need access to PhysioU. They will just get to watch the video in a little viewer. So I think that comes in quite handy. If you think back to, let me go back to assistive devices. You've got stairs, how to get up and down stairs with different types of devices, right? So here's Lofstrand crutches, right extremity, non-weight bearing, and here's your video. You also have, so ascending and descending. You also have things like bed mobility or sit to stand, stand to sit, transfers, and basic wheelchair purpose, education, fitting, how to get up and down a ramp. All of that is now available for the students to learn from as well as share with their patients. All right, so let me go forward here and actually take you into neuro exam. So imagine in your neuro class, you're going to have to pick and choose which techniques or tests you need the students to learn. But imagine all of neuro's examination and testing, and soon PNF, all of those techniques are going to be released. We're in the final stages of releasing PNF. We've been working hard on it. So here's neuro exam. So you're going to say, guys, we're going to learn some balance tests this week. So I want you, before you come into class, to look at Romberg, to look at 5 times sit to stand or timed up and go, Berg balance test. And I want you to watch it once so that when we come to class, one, we can watch it together or I can demonstrate it. And then you can take your resource and go practice. Can you imagine how we used to just give them a binder that was like 400 pages of black and white pictures for all these tests? So that's gone. So now we just use this, and the students feel so confident that they can watch it ahead of time, learn it, and have that resource with them in class. You know, this includes, of course, if you look at diagnosis-specific vestibular, spinal cord injury, you've got all of Asia, motor and sensory. You've got stroke, Fugl-Meyer, and stream. I mean, again, there's way more than you're probably going to ever have to use, but we're using this primarily for clinicians as well as students. So we filmed everything that was needed for neuro. And the interventions are coming next. The interventions are about to be released, hopefully by CSM.